The story you are about to see is true. Only the names have been changed to protect the innocent, and to protect those guilty of spreading misinformation about maggot therapy. These dialogues were collected from patients and healthcare professionals from all over the country, possibly even from your own neighborhood. They were put into this dialogue as a composite, to make it easier for us all to learn from their experiences. If you are a witness to criminal actions or misinformation about biotherapy, contact the Better Foundation immediately. Better yet, take corrective actions yourself, by educating all parties involved.
Good morning, Dr. Barber.
Good morning, Ms. Rich.
That's Richie.
Ms. Ritchie.
Doctor, you have been treating the wound on my foot for 2 months now, and it isn't getting any better. I'm scared because my father also had diabetes and a wound on his foot, and he ended up getting his leg cut off because it never healed.
Now calm down, Ms. Ritchie. It's true that many non-healing wounds in diabetics eventually require amputation, but your wound is only 2 months old and I am sure we can heal it up just fine.
Well, my friend told me to ask you about maggot therapy. She said it worked great for her wound, and really fast. Do you think that might help my wound?
Your wound is not bad enough to warrant maggot therapy.
How bad does it have to be?
Well, it needs to be bad enough. It needs to be bad enough. Bad enough to justify using maggots. Bad enough that it won't heal with anything else. And we still have lots of wound treatments to try. Literally thousands of medications, creams, ointments, dressings, surgical tools and procedures. Lots to choose from. They don't always work, but we can always choose another one if the first or second one doesn't work.
And how many other treatments do you have to try before you try maggot therapy? We've already tried about 6 different treatments on my wound.
See what I told you? We still have over 2,000 other options to choose from. It definitely isn't time to consider maggot therapy. Let's not give it another thought. I'm the doctor here, so this is what we will do. Get the enzymatic debreeding cream I told you about, and make an appointment to see me in 2 weeks. Ms. Ritchie, how are you doing?
I'm okay, but not my foot. When you unwrapped it a few minutes ago, it didn't look any better than before.
No, it didn't look any better to me either. We are going to have to change course again. I'm going to start you on an antibiotic pad that you should change every 3 days. It's a bit pricey, but you're worth it. And your insurance will pay for it, so do not worry about that at all.
Doctor, my friend was talking to me about the maggot therapy again, and she said they worked real good for her, and...
Maggots are not good. They are bad. That's why they call them maggots.
But doctor, they are called maggots because they are baby flies. Maggots are fly larvae. Larvae of butterflies are called caterpillars. Larvae of beetles are called grubs. And larvae of flies are called maggots.
As I told you, they are called maggots because they are maggots. Maggot means something that is bad. They wouldn't be called maggots if they weren't bad. Maggots carry germs.
Doctor, you told me that my wound was already infected.
Sure, your wound is infected, but maggots could make it even worse. Maggots are found on dead things, not live things. They eat infected and dead things. They spread germs.
I'm not talking about using wild maggots. I'm talking about using medicinal maggots. Maggots made for treating wounds. They are germ-free, disinfected.
You cannot make a maggot germ-free. Maggots live in germs. They need germs to live. They are covered with germs, and they spread germs to everything they touch.
Medicinal maggots are disinfected. The germs are killed. Medicinal maggots are germ-free. The FDA wouldn't allow them if they spread infections.
What does the FDA have to do with it?
The FDA allows the sale of medicinal maggots. They regulate them as a prescription medical device for treating wounds. They would not allow it if maggots carried germs and spread those germs to patients.
Ms. Ritchie, maggot therapy is not what you need. Trust me, I'm the doctor, not your friend. I will have your wound healed in no time. Now give that appointment slip to the nurse and see me in 2 weeks.
Good morning, doctor.
Good morning, Ms. Ritchie. How are you feeling?
Not too well. I'm a little nervous about having surgery. The only good thing about being in the hospital is that someone else will be taking care of this wound for a while. And I finally get to have my house fumigated while I am in the hospital.
Ms. Ritchie, this is exactly what you need right now. We will give you some IV antibiotics. I'll take you to the OR in the morning and get that sore all cleaned out. In a couple days, if you are doing well, you'll be back home, good as new.
Good as new, but still with a big hole in my foot.
A clean hole, Ms. Ritchie. And cleaning, or debriding that hole, is the first step to getting it all healed up. Debridement is one of the best things we can do for that wound.
Doctor, I saw another program on maggot therapy. They called it MDT for maggot debridement therapy.
Not maggot therapy again. Ms. Ritchie, I can clean the wound in the OR in just a couple minutes. Snip, snip, snip. All done. Maggot therapy can't do that.
But doctor, I'll be stuck in the hospital for 2 or 3 days.
Well, Ms. Ritchie, didn't you say that you finally get to have your house fumigated while you are in the hospital? If you don't stay in the hospital, that couldn't happen. If you get maggot therapy, you might have to go home much sooner. Or you may not be able to stay in the hospital at all, since it is often done as an outpatient procedure. What would you do then?
I think I could handle that.
No. Ms. Ritchie, you couldn't handle that. Why do you want maggot therapy anyway? Nobody wants maggot therapy. I asked my nurse just the other day, would you like me to put maggots all over you? I said. She said, no, maggots are disgusting. Then she said something about being a married woman. So you see, Ms. Ritchie, the whole world knows that maggot therapy is disgusting.
Doctor, it is this wound that is disgusting. It is this draining, stinking wound that is disgusting. It interferes with my life. It scares me to think of what might happen if I don't get it healed straight away.
Wanting maggots on your wound is not normal. Maggots on wounds is not normal. It's not natural.
So, you don't think maggot therapy is natural?
Maggot therapy is not normal. Nobody really does maggot therapy anymore. It's antiquated.
I read that 50,000 maggot treatments were done last year.
Yeah, probably in Africa, where they still practice voodoo medicine.
Actually, voodoo is from the Caribbean, and the 50,000 treatments were performed mostly in the US and Europe.
I'm telling you, maggot therapy is not normal. You are just nervous about surgery. Well, listen, it's normal to be worried about surgery. But you'll see, once we get your wound cleaned up, it will have the best chance of healing ever. Well, you're right, Ms. Ritchie. The wound did get bad again. It was nice and clean for a couple weeks though, wasn't it?
Doctor, you have been treating my wound for nearly 6 months now, and it is no better. In fact, it's been getting bigger.
But it was nice and clean for a couple weeks, wasn't it?
My friend suggested that I ask again about maggot therapy. She said that maggot therapy is sometimes used for maintenance debridement, and can keep the wound clean and healthy until a graft is put on.
Yes, well, we don't need maggot therapy around here. We treat lots of wounds, and we have lots of ways of treating them, without having to resort to maggots. I've never had a wound that needed maggots. I've always been able to heal the wound without maggots.
Are you saying that you've always been able to heal your patients' wounds?
Did you know that your insurance probably won't even pay for maggot therapy?
Actually, my friend has the same insurance that I do, and the insurance paid for her treatment. And she said that the Better Foundation provides patient assistance grants to help pay for the maggots for patients without insurance.
Fine. I'll tell you what. Since I'm the wound specialist, I'll let you know if we need maggot therapy. I'll tell you as soon as you need it.
Thank you, doctor.
Now give your paperwork to the receptionist for an appointment in 2 weeks, and take that prescription I gave you to the pharmacist. Yes, Miss Ritchie, I know it must be hard to hear that you need an amputation, but there really is no way to save your foot at this point. The blood circulation studies we did last week show that you no longer have enough blood flowing into your leg to heal that wound.
But doctor, why do you have to cut it off at the knee? The wound is on my foot.
You do not have enough blood flow in your foot, even to heal the surgery, if we did it there. We have to do the surgery where you have enough blood flow to heal. And that is just below your knee.
Doctor, can we try maggot therapy now, at least as a last resort? I want to save my leg.
Your wound is too bad for maggot therapy. Maggot therapy will not work. Nothing will work. We have to amputate.
6 months ago, you told me that my wound wasn't bad enough for maggot therapy, and now you are telling me that my wound is too bad for maggot therapy. Why is it now too bad for maggot therapy?
Your wound is not healing because you no longer have much blood flow reaching your foot. You simply do not have enough blood flow to heal this wound, or even a surgical wound in your foot. We need to cut it off.
Wait a minute. My wound went from being too good for maggot therapy to being too bad for maggot therapy, without a trial of maggot therapy. Why don't we try maggot therapy now? Before cutting off my leg.
I'm not going to cut off your whole leg. Just the bottom half.
In published studies, subjects scheduled for amputation but treated with maggot therapy as a last resort, 50% of patients treated with maggot therapy were able to avoid amputation and heal their wounds. That's 50-50 odds that I could keep my foot.
Maggot therapy probably won't work.
A 50% chance of keeping my foot is good enough for me. In fact, I would wear a dressing with maggots in it, even if it only gave me a 20% chance of saving my foot. An amputation leaves me with no chance, and no foot.
I have done hundreds of amputations, and I will tell you that your foot has no more chance of healing than any of the others, with or without maggot therapy.
How many of the others did you try to save with maggot therapy?
I have never bothered with maggot therapy, and I never will.
Well, then how do you know that none of the others could have been saved with maggot therapy?
Are you saying that you don't trust my judgment? Who are you going to believe? Me? Or a maggot? Use maggots, you say. How dare you insult me like that? Do you think I need maggots to help me?
No. But I might need maggots. To help me. To help my wound.
Do you think maggots went to medical school?
No. But...
In case you hadn't noticed, my brain is a lot bigger than their brain.
Yes, I did notice you have a bigger head. A very big head.
I don't need help from maggots. I don't even need help doing the amputation. I could do it all by myself. The only reason I asked Dr. Carrion to assist me is that I will be able to finish a lot faster. Besides, he needs the money. But I don't need maggots. I've never done maggot therapy before. I don't do maggot therapy, and I'm not going to start experimenting on you now. We don't need maggot therapy around here. We treat lots of wounds, and we have lots of ways of treating them, and we have never needed to use maggots. Now, a few weeks after surgery, Once the swelling settles down, I'll have you fitted for a prosthetic leg. After that, you'll be walking around like normal. You'll hardly notice the difference. Just take this form to the receptionist, and she will schedule your surgery. We will take care of all the arrangements. You just relax. After all, that's what we are here for.
Are you the victim of diabetes? Are you the victim of a non-healing foot wound? Don't be the victim of medical ignorance too. Ask your doctor about maggot therapy. And if your doctor has no prior experience or knowledge about maggot therapy, ask someone who does. Remember, they are your legs, so take care of them. Use them, but don't abuse them, or you'll lose them. And if you don't stand up for your legs, they may not be around to stand up for you. The Better Foundation teaches courses in maggot therapy to doctors, nurses, and other therapists. If you have any questions or concerns about maggot therapy, contact the Better Foundation.